Welcome to Raaonline. Now we'll have a very short discussion on bee and wasp stings, the clinical features and the management. So a few slides on introduction. Bees and wasps are grouped under Hymenoptera species, and most of the people usually develop only minor local reactions with these stings. But there are certain group of individuals or patients who have venom allergy, and these are at high risk for systemic allergic reactions, or otherwise called as anaphylaxis, which can be very severe and sometimes even very fatal. So coming to the clinical features in short with bee and wasp stings. So broadly it can be classified into a local reaction or a systemic anaphylactic reaction. Local reaction can be again classified into two, which is uncomplicated local reaction or a large local reaction. So what do you understand by uncomplicated local reaction is, if you see the picture, see this is the bite site or the sting site. So there is just local redness and swelling only at the sting site, which is called as uncomplicated local reaction, and this is what is very common. And second entity among the local reaction is large local reaction, which can occur around 10% of the stings. So 10% of the individual with these stings can have a large local reaction. If you see the picture, see the swelling. So you have a pronounced or exaggerated redness and swelling at the bitten site. So that is called as large local reaction, and usually it starts increasing, and it can attain a maximum size around 48 hours, and then later it starts regresses, and it will regress to in around 5 to 10 days, right? So this is a usual progression of symptoms of a large local reaction. Now coming to the treatment of these local reactions. So if it is an uncomplicated local reaction, which is just characterized by a small swelling and pain at the bitten site, just cold compresses will be enough. Whereas in case of a large local reaction, which we saw, like if it is characterized by involvement of redness and swelling, which is involving around say 10 centimeters or more at the local site, then it needs treatment with steroids and antihistamines as required. So you have to give these individuals cold compresses, and if the sting is on the extremity, you can advise them limb elevation and a short course of oral steroids, preferably oral prednisolone. 40 to 60 milligram can be given as a single dose, and it can be rapidly tapered over 2 to 5 days, which will help in reduction of the swelling. And if it is a painful reaction, then probably you need to give NSAIDs. And in case of pruritus, you can treat them with oral antihistamines like oral cetirizine of 10 milligram once daily, or even a highly potent topical corticosteroids can be used, like clobetasol can be used, and until the itching subsides. Now the question comes, should the insect or the stinger be removed from the skin? So usually see the bees, they have barbed stinging apparatus, which usually gets lodged in the skin, and it rips away along with the venom sac from the insect body. You can see in the picture, the sting along with the venom sac gets ripped away from the insect's body following the stinging event, and then the venom is released within few seconds after the sting. So if at all, if the insect or the stinger, if it can be flicked off from the skin immediately, then that can be done, because that is going to help in reduction in the amount of venom that is getting injected. But then if the patient presents minutes later, then immediate stinger removal is not going to be of importance, because already the venom would have got injected, right? But then later on, the stingers needs to be removed, because that can result in foreign body reactions.